Well, thanks for being here with me as the show goes on. Folks, I honestly, for what it's worth, and if you'll just permit me a personal indulgence here, just for a quick moment, I did have a really restful vacation, and I feel good. Obviously, it was different. Couldn't see family, couldn't see friends. A lot of the things we would normally do, we weren't able to do. But it was still relaxing. I kind of made a point of relaxing, of chilling out, of unwinding, because I knew it was going to be a rough start to 2021. We are going to have a really, really challenging first bit of this year. And I'm an optimist long term on 2021, but my optimism is backloaded well into the year. And the reason it's backloaded well into the year is because the first part of the year is going to suck. There's no nice way to say that. I wish there was. It's going to be a really hard start to the year. The start of 2021 is going to not look an awful lot like the end of 2020, but worse. In Ontario, where I live, the situation with the pandemic is as bad as it has ever been. It has never been this bad. At first, when our case counts were very, very high, we could say, well, that's because we're testing so much more, and a lot of cases got missed in the first wave, and that was true. But there's another indicator, how busy the hospitals are. The hospitals are full of COVID patients. Ontario, probably sometime in the next couple of days, is going to move past its own red line of when the healthcare system would be in serious trouble. We can't change it now. Hospitalizations are a lagging indicator, and they've been mounting pretty steadily over the last week or two. We haven't bent the curve, which means that number is going to keep going up. I want to bring on Alan Bonner, who's obviously one of our regular guests here, and he's an expert in emergency and crisis management and also in communications. Alan, I guess this morning we're leaning more heavily on your emergency management experience here. The Ontario government set out months ago a red line of when it would be in trouble, and that red line was 350 COVID patients in ICU beds in Ontario. As of yesterday's figure, I believe it was 335. So we are 15 patients away from hitting that mark, and that number has been going up steadily. So today, tomorrow, maybe Wednesday, we're going to cross that. And it's not that, the sky falls when we hit 351, but what it means is that our healthcare system stops operating as normal.
Look, I did not have a restful holiday season like you said you did. I listened to some very alarming things, including Alberta says it's not going to be inoculating the general population until the fall. I heard Ontario is going to work on a graduated implementation of the vaccine and get to regular people without, acute need, sometime in June. And frankly, I think this is outrageous. And I'm going to say something colorful to try to make an impression on your listeners. Guess what? We knew Christmas was coming. We knew it in August and September and October and November, and we could have backfilled some of the healthcare workers with retired healthcare workers, with military medics, with all kinds of people who can deliver vaccines, and we didn't need to take that pause. Guess what? We have modeling, I bet you, that showed exactly that occupation level of beds, and we are not prepared. You mentioned my interest in emergency management. I'm not a big fan of how we've prepared for emergency management because in the 100 or so emergency plans I've read, the word pandemic was in one of them. We just went to sleep on this issue, even when the pandemic began. So I am kind of outraged this morning. There's a thing in emergency management called the incident command system, and that has a pillar called logistics, which means how do you feed the responders and how do you get materiel to the site. And this should have been going on since last August. And the fact that we are still planning to bring retired healthcare workers out of retirement to deliver vaccines or training people. By the way, it takes a couple of hours to a couple of days to train people to deliver a vaccine. And those people, of course, could be dental hygienists, dentists, and so on. I'm not a healthcare worker, but I know that there are some people who are close to being able to do that. So those are my top of mind thoughts, Matt.
I saw one thing yesterday as I was getting back into the news again, and the reason my vacation was so restful is because I ignored the news. But one of the things that I thought it was both true but also amusing, talking about getting some of those staff mobilized, was that I saw on my Twitter feed one guy, a veterinarian, say, "Guess what, folks? In an emergency, we are more than capable of putting vaccines into arms." The guy said, "I can vaccinate 30 patients an hour, and they're trying to bite or scratch me." So, if we were serious about this, we would be further ahead. And, on the one hand, we have what appears to be a slow motion disaster about to unfold in our hospitals. And we're responding to this slow motion disaster with a slow motion response. I mean, the vaccines are arriving, and it's not even just that they're not coming in enough quantity, which arguably they're probably not. Canada is falling behind some of our allies in getting vaccines, which is bad. But what's worse is that we're not even effectively handling what we have. Ontario, I mean, there'll be new updated numbers this morning, but I believe the figure is that Ontario has only been able to get about 30% of the vaccine it has received into the arms of recipients here. We're going to lose people over the next few months that didn't have to die because we were slow out of the gate on this.
Absolutely, positively agree with you, and I agree with that veterinarian. I didn't know a veterinarian had said that. There may be some things they need to be trained up to do. The same thing with dental hygienists and dentists and others in the healthcare field. And by the way, there's a concept in the military. Everybody gets promoted one rank in time of war because those people are already in uniform. They're already trained to do something. The people in hospitals and in elder care facilities who mop the floors could be trained up to deliver meals or could be trained up to change beds. And the people who are changing beds and delivering meals and interact with the patients could be trained up to do something higher up the chain of command. Matt, I remind you that this is exactly why Target, a big, beautiful multinational corporation, failed, crashed, and burned in Canada. It was the inability to handle logistics. They had warehouses full of things and stores empty. They had stores full of things and warehouses empty. They had containers in Asia. Their computer program couldn't handle French, the metric system, or Canadian money, and they crashed and burned. I'm not there's no consequence for the government being this incompetent. There will be a consequence at the next election. But when Alberta says no regular people are getting this until the fall, everybody goes, "Oh, how interesting." There should be. This is the thing that people should protest in the streets over, not wearing a mask.
When I was looking at what's been happening in Ontario, and you've identified something very important here, the idea of consequences, right? Because the only person who has really lost their job over any of this has been the Ontario finance minister, who took a beach vacation. Now, arguably, yeah, he probably should have lost his job for that. I'm not saying that he should not have. This is not a lament for Rod Phillips, but I'm wondering here, we have in Ontario a premier, Doug Ford, who it likes to be known as being the business premier, right? He's a business guy. He wants to run government as a business here. Can you, you've already used the Target example, and it's a great one. The Ontario government is not running like a business here. We have a valuable, perishable asset on hand right now, and we are not distributing it effectively here. What's worse is that we don't seem to have undertaken any effort to actually increase our capacity of distribution. Dr. Jennifer Kwan in Ontario, you might have been following her work, Alan. She's a family physician, but what she's been doing as a public service is aggregating every morning all of the various Ontario government health indicators that the government releases. That they release the raw data or they release them on separate platforms, and it's not easily readable. So all she's doing is taking all this information and aggregating it into one useful document that she puts out every morning. At our current rate of vaccination in this province, we will get the Ontario population at 80% vaccination, which is obviously where we think herd immunity would kick in 2032. it would take us 11 years at the rate we're going right now. So what I want to know, Alan, where's the plan to take our current rate of vaccination and double it? And then once we've done that, where's the plan to double it again and then double it again? Why aren't we talking with those dental hygienists? Why aren't we recalling every retired nurse in this province? Why are we not training every rifleman in Ontario Reserve militia regiments to get out there and learn to start giving injections here? Bring in the vets, bring in the troops, bring in everybody, and let's go. As far as I can tell, there's not only do we not have a plan, I'm not even convinced we're talking about coming up with a plan.
Well, we actually are talking about coming up with a plan, but that, too, is ridiculous. We knew Christmas was coming last August and September, and when I heard retired General Rick Hillier, who's very well thought of, by the way, and has only been on the job 3 or 4 weeks, I grant you, talking about getting ready to have a plan sometime in the future to do all these things you say, I thought, that's not the kind of general that I've worked with in the military. The kind of general that I've worked with would say, by the way, I want a list of all retired healthcare workers in the province sometime, by Wednesday. And if you can't get it, I want to know why. Get a hold of the unions, get a hold of the Canada Revenue Agency, do whatever you have to do to get it. Then I want reserve soldiers trained up to deliver the vaccination. Talking about having a plan in the future at this stage, 1 year into the pandemic, is ridiculous. It wouldn't be allowed in time of war. Winston Churchill wrote a famous memo saying, I want a plan by the end of the day to invade France. And the impediments have their own advocate. They don't need to be advocated for or discussed. I want the plan on one page. And he got it. And that was the most monumental action in probably the history of warfare. And we're now talking about developing a plan. I'll tell you, Matt, if I had your platforms in print and on radio, I would write about this until I got a hold of General Hillier and asked him what on earth the problem is.
When we take a look at, we talked a lot about the vaccines, Alan. Let's spend our last couple of minutes here talking about the hospitals. There is growing talk, particularly in the Toronto area, and we should be clear, Alan. I mean, I don't mean the center of the universe here, but Ontario's overall aggregate numbers are bad, but this is largely because of a really, really bad situation in Toronto and its surrounding jurisdictions. Hospitals here are filling up pretty quickly, and I don't know at the rate we're going here if we're going to be able to make do with what we have. There is already some talk about needing to expand some of the existing facilities with field hospitals to handle overflow over the next couple of months. Are we going to be any better off at scaling up hospital capacity than we have been at scaling up vaccination capacity?
Well, I doubt it. What I would do is what the Americans did, especially in the state of New York, and that is open up other facilities such as armories or convention centers without having any conventions anyway. These take a little while to do it. I actually studied hospital evacuation and relocation for 3 months with an emergency room physician, and that's part of a book that I'm writing about this pandemic. You need to essentially put plumbing in there to move compressed oxygen or compressed air and oxygen around, and make the facility hospitable for sick people. It takes a while, and we need to get on with doing this. If you happen to, in the military and emergency medicine, you have a phrase that is 2 is 1, 1 is none. If you don't have redundant capacity, if you only have one of something, forget it. Assume you have none. If we build up one of these armories to take sick people or a convention center and we don't use it, well, that's a happy day. If we don't build it up and renovate it to house sick people, that is a tragedy and people will die. So I don't know why we're not doing it.
Yep. Seems to be something of the theme of recent days and weeks. Alan, Happy New Year to the extent that it will be one. Great to have you back. Appreciate you coming on, man. We'll chat again soon.
Bye-bye.
All right. Alan Bonner, my guest here on the show.